Hey guys, today I'm going to be teaching you about the gait belt. So the gait belt is a device used to transfer a patient from one position to the other, such as sitting on the side of the bed to standing up, or sitting on the side of the bed to standing up, moving, and sitting back down. It can also be used to help patients ambulate around the hospital. This is used in patients who have weakness in their lower extremities. It's often commonly used in elderly patients as well. So what you're going to do is when you use it, you're going to wrap it around the waist, right around here, and then when it comes back around without any kinks or twists, you're going to loop it through here, and then back around through there. You pull tight like a belt, and it's not going anywhere. So you want it to be tight enough to the point where it's secure, but it's not causing pain on a patient. It's not going to slide up or down, and you can get your hands underneath it. So when you go to lift up, you'll reduce some of that pressure. So what you'll do is when you're doing this, if you're transferring a patient, you're going to stand in front of them. You're going to hold on to the belt. And with using good body mechanics, because we don't want to hurt our backs, we're going to help lift up and reduce some of that pressure off of their lower legs. And then we can even turn and then sit them back down. If you're using this while they're walking, you're going to want to stand next to them or behind them, and you're just going to want to hold on to it. You can even lift up a little bit to reduce some of that pressure, but this is just to reduce the chances of them falling. So with my second device, we have crutches. This is a crutch. You guys have seen crutches before. So a crutch is a device used when a patient has weakness in one lower extremity. So if you break your leg, you can't put pressure on your leg. So what you're going to do is you're going to use the crutches to help maneuver yourself around. A lot of people, when they use them incorrectly. When you use this, you want to use this and you want to push up on that. Push up on that as you're walking around. A lot of patients put it underneath their armpits and they'll just lean on those and depend on those to hold themselves up. But you really want to push up on that, leave some space, and then use those to help ambulate yourself around. The third device I have is a cane. It's a candy cane, but it's all I got. So a candy cane, or a cane, is used to help ambulate a patient around when they have weakness on one side of their leg. So they can still use that side, but they can't put a lot of pressure on it. So it's commonly used in elderly patients, and it's typically used for a long time. Well, long period. So when they use that, they're going to have that on the side of their weakness. So if this is the leg that I can't put a lot of pressure on because I had knee surgery, for example, they're going to use the cane. They're going to put pressure on the cane to reduce some of the pressure on their leg. So they'll use that to help walk around, like so. It too will reduce the chances of them falling. The last device that I don't have, is a walker. So a walker is used when a patient has weakness in both of their lower extremities. So what they'll do is they'll take the walker, and it has front and side. So they'll put their hands on the side, and what they'll do is they'll put pressure on that and kind of lift themselves up so they're not putting as much pressure on their lower extremities. So what they'll do is they'll lift up, move it forward, put it down, and then step forward. Lift up, move over, put it down, and then step forward. So all four of these devices can be used to reduce the pressure on their lower extremities, and is often used in elderly patients. It reduces their chances of falling, and there's different varieties. So you have short-term, you have long-term, and all of them are very useful in the hospital. So I think that's all that I have for you guys. I'll see you all tomorrow. Bye, guys.